Assessment biopsychosocial factor. My name is HA Johnson, and I'm a BSN student, Temple student, and I'm gonna talk about my slides that I prepared. Scenario. My introduction. Michael is a 13-year-old boy who visited his pediatrician to have his painful wrist injury examined because it is preventing him from finishing his homework and engaging in other activity. Michael is an urban Latino teen who lives in a lower socioeconomic area. Michael has a sinus infection, so he wants to see his doctor 3 months previously. He has shed a huge amount of weight since then. In comparison to his earlier appointment, he also seems noticeable messier and less properly clothed. When responding to his inquiry, he comes out as cynical and sometimes even angry. Michael misuses the discomfort of his race and retort that his mom is aggravating the situation. The lower arm of Michael's mother are also severely bruised. And there's method of interviewing. So, a social tool for promoting open communication between healthcare professional and the adolescent patient is HEADNESS. HEADNESS, HEEADSSS framework. Home environment. The environment tells the nurse about the patient living arrangement, family composition, financial situation, social network. In Michael's instance, the doctor is already familiar with his resident relative, neighborhood, or ethnicity. So EAL 2020. Education environment result from assessment can provide insight in a patient relationship with peers, co-worker, teachers in a setting of both the workplace and school. The system also helps nurses identifying bullying and performance lapses. Michael, physician, would likely question him regarding his opinion of the school, his future objectives, and his sense of security there. Eating and exercise. The assessment gives nurses detail about patient routine for eating, sleeping, generally taking care of themselves. Michael was also to lose a large amount of weight in 3 months, and the doctor will know why. So, ETAL 2020. Activity and peer relationship. By considering the activity and the peer relationship in this assessment, health professional might learn more about their patient's perspective on life, friendship, risk taking in order to decide whether or not Michael need medicine, and the doctor will use. Sorry, I missed that part. So I'm just going to move on to slide number 3. Drug. So the drug is the assessment enable nurses to learn about the alcohol and cigarette usage of their patient. One could argue that if Michael uses drugs, the doctor would already be familiar with the drug's effect on him. Sexuality. The assessment aids physician in understanding patient how their patient view gender role, sexual behavior, and orientation. Suicide and depression. So medical professional can learn about a patient propensity of mental health issues and self-alarm, as well as coping mechanism and access to support by conducting the depression suicide risk assessment. So ETAL 2020. Safety. Using the strategy, doctors can learn about the risk behavior of their patient as well as the safety of their household. Slide number 5. Questions to ask an adolescent patient. Do you now smoke, take drugs, or consume alcohol? The rationale behind that is that it makes sense to find out if the adolescent patient has ever used drugs like cannabis and alcohol when they were with friends, given that many teenagers often experiment with these substances. Question number 2. Do any of your friends or family members use tobacco, drugs, or both? Rationale behind that. Young people can be influenced by peers to take drugs that that's critical for follow-up. Slide number 6. The brief scenario for tobacco, alcohol, and other drugs. BSTAD is a tool. It is recommended to use this medical BSTAD is recommended for use by medical professionals to determine if teenage patient are at risk for drug abuse issues. Simon 2020, doctors can swiftly and effectively integrate brief evidence-based screens into their medical practice, utilizing a screening tool by asking patients how frequent they consume medicine. BSTAD is a rapid screening tool that may be administered by medical professionals in only 2 minutes using the computer or tablet. Researchers have determined that Vistat can successfully identify between teenagers with or without substance use disorder using samples of adolescents. It outlined the results, ramification, and suggests next step for working professionals. Simon 2020. The rationale behind accepting Bistat is that it normalizes productive conversation with kids about drug usage, which is crucial because substance addiction can be negative, can have negative effect like decreased academic performance and mental health problems and engagement in criminal activity. Slide number 7. The question for adolescent patient suspected of experiencing domestic violence. Who live with you and where do you live? Rationale behind is that today seeing news reporters about yet another violence or domestic violence cases is commonplace. Determine whether such disagreement harm the patient's family is crucial in order to properly provide treatment for the patient's emotional problem. Question number 2, at home, do you feel secure? The rationale behind is many teenagers and young adults suffer in silence, such as silence as a result of argument that start whenever family members disagree. These type of conflict are brought on by aggressive behavior and misconception, both of which can be avoided if the parties avoided involve adapt more cordial viewpoint. Using psychosocial history to assess patient health, biological, social, and psychological. The psychological is self-esteem, coping skills, social skills, and then the social is family circumstances, the school and the peers. And then the biological is the physical health, the disability or genetic vulnerability. That is the biological part. Slide number 1 is biopsychosocial modes. The complete range of biopsychosocial framework is used to assess a patient's health and sustainability disease. In addition to social and cultural factor, there are also physical and mental factor. The patient medical diagnosis is crucial since it is considered the patient's present state of health. With this Ms. Kuto ETAL 2020, genes, genes can have an impact on a person's behavior, emotional, and other processes. The biology of the body and the person's propensity for disease or health or direct related with genes acting as a deciding factor. Ms. Ms. Kutu ETAL 2020, because everyone biological makeup is unique. Some people may be prone to illnesses than others. Then that's psychology part is the medical profession that assess a person's ability to handle and adjust to variety of stress experience. The success of the treatment depends totally on the person's attitude toward it. It is thought that the benefit of attitude on health also motivate a patient to enhance to the treatment regimen. Mosquito ETAL 2020. For the precise diagnosis, the social and the cultural milieu of a person must be considered. These features together with the patient age, gender, race, culture, and family history also be taken into consideration. Last, once the relationship between the social determinant and the health and psychosocial factor, both biological and social element, also referred to as social determinant for health and biopsychosocial factor, affect one's health and well-being. The term social determinant of health is used to describe elements that are beyond a person's control and have impact on health. Rogers ETAL 2020, and then the numerous elements that are listed beyond the determinant, such as socio-economic standing and geographical and physical environment, social network, educational, entertainment, environment, opportunity, and the access to healthcare. The interaction between the social setting, human behavior and human behavior biology is now recognized by researchers as a critical series of events that affect a person's health and a welfare in all socioeconomic and geographic content. Rogers ETAL 2020. These elements are very crucial in determining the caliber of nursing care because they aid in lowering healthcare disparities, which in turn help patients. References are listed on the last one. Thank you.